Good morning, everyone. Again, we will reconvene our Public Health Committee meeting. We want to thank everyone for their patience. We will have the remarks. As you'd heard earlier, we just wanted to have a brief caucus about some of the bills. I also wanted to remind everybody there are multiple meetings happening as we speak, and there are votes being taken in multiple different parts of this building. We have transportation, environment, and other committees that are going on, and finance as well. So you will not see as many legislators in this room, but you will see some of the people online. But we are all here, and we'll be voting in the midst of our conversation. I wanted to thank all the committee members for their time with us and all the work that's gone on, and our LCOs and Office of Legislative Research for the work that they have been able to do along with the entire management administrative team. We are not able to do so many things without each and everyone doing the work that they do, and everyone who's come out to speak to us in the public hearing as well. So my Madam Co-Chair, Representative.
Thank you, Senator Anwar, and I'd like to echo those thanks and to all who have participated in this process today as we continue to vote bills out of committee with both the language and substitute language in one case. We know that, and you'll hear over and over again, that these bills will remain a work in progress and conversation, working together with our ranking members and leadership of the committee. So thank you, and back to you, Senator.
Representative Claridis Dietra.
Thank you, Mr. Chair. And to reiterate what the chair said, most of these bills are truly works in progress. So they do. Some of them have a lot of work to be done. And as Senator Summers always says, there's something in all these bills for someone to hate. Thank you, Mr. Chair.
But a lot to love. With that, we will have. I don't see Senator Summers on yet. She's probably in another meeting at this time. Oh, she's just joined. Senator Summers, would you like to say some remarks? You're welcome to do so. I think she's probably there. She is. Good.
Good morning. I'm ready to get going on this hearing today, and I just wanted to reiterate what Representative Claridis Dietra has said, that many of these bills are not finished. They're works in progress. So many of us will be voting for them to get out of committee, but they have still much work to be done. So if people are watching that are unhappy with certain language, many of the language and many of the bills is still going to change. There is still time to make adjustments. And I just wanted to make sure that's I'm ready to get going. Thank you.
Thank you. With that, we'll go to item number 3, the Roman numeral 3, with bills to be considered JF action. First item on the list is Senate Bill 1, an act concerning the health and safety of Connecticut residents. This is a proposed action to JF to the floor. We will entertain a motion to JF this bill to the floor.
So moved.
And seconded as well. So moved by Senator Marks, seconded by Representative Kristen McCarthy-Vahey. I will just go over the details of the bill for everybody's benefit, and then we can have a conversation and perhaps vote right away after that. So there are multiple parts. This is a bill with many parts to it. The first 9 sections are about home health care workers safety language. This part of the bill is in honor of our healthcare workers who have lost their lives, and especially Joyce Grayson, who just passed away a few months ago. This is to make sure that our healthcare workers are safe. We have heard from a number of people who came from to give their testimonies about this bill. Section 1 may have some opportunities to improve, to streamline and make clear some of the language, but we are looking at a number of components in this bill. One is to have a risk assessment done in a timely fashion, have training process also of our healthcare workers, and then reporting mechanism for the Department of Public Health if there is violence of any kind against a healthcare worker, and looking at the payment reform opportunity, and also coverage for escort by insurance, and also DSS if somebody is in a high risk situation. and also look at Department of Public Health to have a grant program for panic buttons or safety device opportunities, and then have a group that will convene to look at the coordination, communication, and streamlining this process. So this is one part of the bill, and I'll go through the entire bill, and then I'm sure people have questions and comments on various parts of the bill. I know Senator Marks, you had to say something on part of the bill as well, so I'll go through the entire one and then we'll have you speak. Section 10 to 18 are about graduate physician language. The purpose of this is that the number of residency programs in United States have been decreasing because of financial reason. The number of medical students who are graduating medical schools have been increasing, and there is a mismatch. About almost 10% of the students who are graduating do not match because of lack of enough spots, not lack of their capacity. And that actually, unfortunately, is a weakness in our federal policy, to the point that these individuals who are willing and capable of working in some capacity and continue to learn are unable to do so. There are individuals who are working in different capacities between doing odd jobs at this time, and they are fully trained medical personnel, except that they have not had a residency. We have to fix this, and unfortunately, we have not been able to fix this. Other states have done this for over 10 years. It's time Connecticut would wake up to this reality, as well as we are seeking primary care physicians, psychiatrists, OBGYN, and all of these specialties, but we have not made a policy to address that. This is also work in progress. You'll hear this frequently. There are conversations that we need to have with the DPH and other individuals and groups to address this as well. Section 19 is about annual physical. When an annual physical is performed, it's important to ask about seat belts and all the details, but one of the questions that needs to be asked is about the gun safety as well, and that would be part of the question that we are trying to make sure that it's going to be part of an annual physical. Section 20 is about a working group to be created for a condition called NASH, which is non-alcoholic steatohepatitis, which is another fancy way of saying fatty liver disease. What is happening is, in the state of Connecticut, we have an epidemic where the fatty liver disease is increasing. It is more so in some of the communities, and it is important to have a comprehensive plan going forward to be able to address this and make sure that we have a plan of action. Some of our communities are being impacted. Now we are seeing, unfortunately, people as young as in their 40s or 50s who are developing cirrhosis, who have never touched alcohol in their lives. And this is the time for us to try and have a plan of action for that. Section 21 is about creating a working group for nail salon worker safety. We have seen cases where ovarian cancers and other cancers and diseases are seen in nail salon workers. We are hoping to have a strategy going forward for protection and prevention, and then appropriate setups to be able to reduce the risk and have a better comprehensive plan in the state. Some of the towns, including Hartford, has looked at how they can protect the nail salon workers. We are hoping that the rest of the state can start to be part of this opportunity. Section 22 is a study regarding drug shortages. We have a nationwide shortage of medications. There are certain medicines that have been in the market for multiple years. Unfortunately, there is a shortage of medications at this time, for more so in different arenas, which include anesthetics, anesthesia medications, whether it's it's something that's at a federal level, but the federal government has not been able to address this fully at this time. But we as a state need to make sure that our citizens are protected. So we are looking at a strategy within the state of Connecticut to see what are the different steps we can take, so that if somebody needs to have a surgical intervention or any other medication needs, that we can actually have a plan of action for that. Then Section 23 is, we will pass this out of the committee. This is something that the Children's Committee is looking at as well. So this is just making sure that in some of the homes, we do not have remote visits, we would have in-person visits. So, and then we have already had the Children's Committee is looking at this, and they've already passed this out of their committee. The next section, Section 24 and 25, is about maintenance of certification examination by physicians. There are private groups that are actually testing individuals every few months, and that has a result, and this is a sort of a money-making scheme They have made some $63 million just having people do tests on a pretty much very regular basis, and it's money grab issue. 22 other states have actually stopped this from happening. We just want to be the next one in line to be able to address this as well. 9 out of 10 physicians have asked for this in the surveys. It's something that needs to be addressed. Section 26 and 27 is about safe disposal of opioids. This is again a conversation that we had yesterday or day before in the public hearing, where we were looking at what is a safe disposal mechanism. There are ways you can use this, and we are looking at co-prescribing opportunities, but we need payment opportunities to be able to address the safe disposal devices for this. The only thing that the current bill has a recommendation that is for the payment, which will need to be changed. And as we move this forward, we will be able to change that language. Section 28 is for the National Labor Relations Act. The state of Connecticut for the physicians is not following the NLRA and the recommendations and NLRB recommendations. We are just making sure that they would be following the federal laws in the state of Connecticut. Section 29 and 30 is coverage of insurance and recognition of the calcium scores, which can identify coronary artery disease early. Unfortunately, Medicare isn't covering this. Many insurance companies are not covering this. This is something that would allow us to be able to identify diseases early and then be able to intervene and prevent major disaster from happening. Section 31 and 32 is about cybersecurity. If you recall, a few months ago, 3 of the hospitals' functionality was impacted because of cyber crime, where a group had actually hacked into the healthcare system and just shut it down. This is very dangerous because everything that we are doing in our healthcare or any other different work that we do, it's very much linked to the computers and electronic medical records and communication systems. So we have to have a comprehensive strategy in the state of Connecticut. This bill is going to start to look at what needs to be done to be better prepared, and also have a rapid response if, God forbid, another cyber crime or cyber attack happens. And the reality is that it's not a matter of if, it's a matter of when it is going to happen. And this is happening across the country. We just need to be better prepared as a state, and this is going to address that aspect. And Section 33 is very special, and we do have guests over here to be witnessing this. This is about starting Healthy Brain Initiative. This is one of the top priorities for Alzheimer's Association as a no clapping, thank you. No clapping. I get into trouble for that, but you can actually do this if you want. That's fine. Yes. So the reality is that dementia is on the rise. It is increasing, and we as a state need to be better prepared comprehensively to be able to address this. And in order to do that, we will need all hands on deck. This is basically an all hands on deck bill to be able to say that Department of Public Health, Office of Health Strategies need to start to look at what needs we will have, what kind of a workforce we will need, and what are the comprehensive strategies that we will need to be able to provide care, and also start to invest into prevention aspects and comprehensive treatment for this. So this is an important bill that we are hoping that's part of it. And somewhat linked to this is Section 34, which is Parkinson's disease. We are doing 2 things. We are creating a committee to have a Connecticut coalition to end Parkinson's disease. And this is also going to be also associated with this committee helping creating a Parkinson's registry. We will need to do far more research into this arena. This is one of the fastest growing movement disorders, and there are opportunities for early identification and early management, and also late stage management as well. The technology is advancing very fast to look at what can be done to address this. So we are hoping to be able to do this. In the public hearing, some of the people had come and asked and mentioned that our timelines for them, these bills were very strict, so we will be changing the timelines. We were basically, because of the need, we wanted to do it like yesterday, but they said do it tomorrow, and we will do it in a few more months than we were planning to do this. Next item number, Section 35 is a pilot program that had been initiated, which was the STEP program. This program is focusing on the first episode psychosis. In the last few years, Public Health Committee has taken on mental health, and we have created plans to be able to address the mental health needs of our children and adults. But one of the area within mental health, which is very difficult to manage, is psychosis. In the state of Connecticut, with collaboration from our healthcare systems, Yale has been at the forefront along with DEMIS. They've created a pilot program which has shown excellent results to have a comprehensive strategy of management of patients. This is called the first episode psychosis program, where we are able to have a comprehensive plan as soon as we identify an individual with the needs. And that is something that we want to try to have it codified as a part of our laws, and continue with this, and continue to be the model for the rest of the country to follow. Section 36 is a working group regarding loneliness. This is real. We have heard from Senator Murphy. We have heard from so many community members. We have heard from people who have been raising awareness about this being an epidemic in each and every one of our communities. This is looking at creating a working group to address that as well. But we are trying to, with this working group, is focus on how to take it to the individual towns and cities to be able to be better prepared, because that's where the majority of the challenges can be addressed as well. You can have a central place to work on this. This language will change as well to be able to reduce duplication. There are existing groups doing some good work. We want to incorporate their presence and their experience into this, and we will be adjusting our language to address that. So with that, that's section 36. I will stop here. This was a brief summary of the bill. Madam Co-Chair, do you want to say? Senator Marks.
Thank you, Chair. I just want to talk about section 1, the home care health safety section. It definitely will be tweaked, because what ends up coming out at the end is going to be something that I can be incredibly proud to say that I had the leadership saw how important this was to our workforce, and that it's going to be something I'm very proud of. So I want to thank both the co-chairs for taking it so seriously, and for my caucus for taking it so seriously. And there will be lots of tweaks. And but right now, even as it stands, it is a very good bill. Thank you.
Thank you. Senator Summers, followed by Senator Gordon.
Yes, good morning. One of the things I wanted to say, first of all, thank you for all the hard work that went into this bill. It's a combination of we're very aggressive for having those working groups to support DPH with their recommendations. I think you touched on that. I couldn't quite hear if you did. I'm a little concerned about what we're going to run into as far as the costs associated with implementing parts of this bill. So I think as we move this bill forward and make tweaks, we can see where we can possibly find the budgetary dollars to be able to implement what is required of this bill. But it is a comprehensive bill with a lot of really positive healthcare initiatives, and I'm happy to support it coming out of committee today.
Thank you, Senator Gordon.
Thank you, Mr. Chairman. I do understand that it sounds like there's going to be a work in progress, and although we're having to take votes in the committee today on a bill that's a JF, not a JFS, so I do share a concern about what may ultimately be changed in this bill outside of committee. But I do have one question and then a quick comment. I have a question about section, or to flag an item in section 26, which is about giving out personal opioid drug deactivation and disposal systems. And I just want to ask a logistical question, or raise it if this bill is going to be worked on. My copy that I'm referencing starts at line 631, and it talks about each pharmacist who dispenses an opioid drug to a patient in this state shall provide to such patient at the time such pharmacist dispenses such drug to such patient a personal opioid drug deactivation disposal system. And logistically, I just want to make certain that it can be addressed, that we're not unduly and unfairly tagging our pharmacists especially out in the community, that if for some reason they run out of these kits and a patient comes and legitimately and rightly so needs a opioid prescription filled, that either the opioid is not going to be held to be dispensed because they have to wait to get a supply of these deactivation kits, or if they dispense the drug following a valid prescription, and then later they can get the kit to the patient, that there's not going to be some provision that there's a complaint filed against them or they're in jeopardy. So I just want to raise that. That's just a real world concern that I have, and wanting to make certain our pharmacy colleagues are protected in the good work they do. I know there's a number of some good provisions in this bill. I agree with the chair about the whole board recertification issue. Facing it myself as a doctor, I think it's gotten way out of hand, and I agree that that's a good provision, as well as, for example, the provisions that were talked about what we can do to look at healthy brain initiatives. And I do agree, and I certainly see it myself as a doctor with a number of my patients. It's a growing issue that should be looked into, and I know the feds are looking into it as well. So I welcome that, but I won't go over, for sake of time, other concerns I have in other parts of the bill, other than just to highlight, we got to really then see what do we do if this makes it out of committee versus having the opportunity to discuss things in committee. Thank you, Mr. Chairman.
Thank you, Representative Wielander.
Thank you, Mr. Chair. I just wanted to clarify a quick question on Section 33 and the Healthy Brain Initiative. Specifically wanting to confirm that this would be an initiative that is available to, we were looking at extending to all ages. We have had a strong impact in our community from residents with childhood epilepsy, and I just want to make sure that we're including all of our residents.
Yes. Thank you.
Perfect answer. Thank you.
Oh, Representative Claire, teacher.
Thank you, Mr. Chair. And you've heard today that this bill truly is a work in progress. There are some sections that I love in this, but there are so many that I think truly need a lot of work. I'm going to flag this today with a no vote. But I do, like I said, there are very important parts of this bill that I like. And I think moving forward, we need to work and make sure we get this bill correct. Thank you, Mr. Chair.
So this is work in progress. You're right. And Representative Kristen McCarthy-Vahey.
Thank you very much, Senator Anwar. And I'd like to thank Senator Marks and Senator Anwar for their leadership in terms of looking at the safety for our workers. You might recall hearing me say last year many times, I haven't said it as much this year, making sure that we're helping the helpers, the people who are taking care of us at our most vulnerable moments. And we need to assure that we're doing everything we can to keep them safe as they help us stay alive in some cases. So I'm very grateful to that. We've already talked about the fact that this is a work in progress, and just specifically wanted to comment on remarks made regarding the pharmacists. That's a great example of what we heard during testimony, and in part because of the multiple sections of the bill. And some sections may need more discussion and work than others. Some just need some minor changes based on the feedback we've been given from the public and other stakeholders. And that's one of the reasons why we are going to keep this bill moving forward, but we will be remaining in conversation. And so we'll continue to receive feedback via email, phone calls, meetings, and certainly through our screening process and working with our ranking members as well. Thank you, Mr. Chair.
Thank you. Seeing no other comments or questions, Madam Administrator, can we have a roll call vote, please?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy-Vahey,
McCarthy-Vahey votes yes.
Senator Kushner,
Senator Kushner votes yes.
Senator Marks,
Senator Marks votes yes.
Representative Parker,
Senator Parker votes yes.
Senator Summers,
Senator Summers votes yes.
Representative Clarice Detrier,
Representative Claire Destetria votes no to flag.
Representative Belton,
Representative Belton votes yes.
Representative Burger Givallo, Senator Cabrera, Representative Carpina, Representative Cook, Representative Dauphiné, Representative DiCaprio, Representative D'Amico,
D'Amico votes yes.
Representative Denning,
Representative Denning votes no.
Representative Elliott, Representative Jengo,
Yes.
Representative Gilchrist,
Yes.
Senator Gordon,
Senator Gordon votes no to flag it.
Representative Cavers DeGraw,
Cavers DeGraw votes yes.
Representative, are you in the room or are you on Zoom?
On Zoom, ma'am.
Thank you. Representative Kitt,
Representative Kitt votes yes.
Representative Kennedy, Representative Linehan,
Linehan votes yes. Thank you.
Representative Morrow, Representative McCarthy, Representative Palm, Representative
votes.
Perrello,
Tom votes yes. Sorry.
Representative Rader, Senator Rahman,
Senator Rahman votes yes.
Representative Reddington Hughes,
Reddington Hughes votes no.
They can compare apples.
Representative Ryan,
Representative Ryan votes yes.
Senator Slack, Representative Steinberg,
Representative Steinberg votes yes.
Representative Tersiak, Representative Wielander,
Representative Welander votes yes.
Representative Zopkis. Thank you, Madam Chair. Mr. Chair,
It's okay. I answer to both. Bev, Bev, I think you missed Representative Rader.
Representative Rader votes yes.
Good. Okay. Moving to the next item, I just want to make a quick little, actually, Madam Co-Chair, if you want to make a statement.
Thank you, Mr. Chair. Senate Bill 9, we will be holding and we'll take up on Friday. We will be getting some substitute language. And so as a result, we'll wait to make sure that we have that in place and are able to get that to everyone in a timely fashion before Friday's meeting. Thank you, Mr. Chair.
Thank you. We'll take item number 3, which is Senate Bill 273. It's an act concerning nursing home staffing. Proposed action is JF to the floor. We will entertain a motion to move this bill. Representative Kristen McCarthy Vahey, is there a second?
Second by Senator Rahman.
Seconded by Senator Kushner. She's faster than you are, Representative Rahman. And with that, we'll have a brief conversation on this bill. This is an important bill. This is actually just clarifying some terminologies. Care in the nursing home is critical. We are just defining the direct care, and I'll just mention what that is being defined as. Direct care means hands-on care provided by a registered nurse, licensed pursuant to Chapter 378, licensed practical nurse, license pursuant to Chapter 378, or a nurse's aide to residents of nursing home as defined in Section 19A-563, including but not limited to assistance with feeding, bathing, toileting, dressing, lifting, and moving, administering medications, promoting socialization, and personal care services, but does not include food preparation, housekeeping, laundry services, maintenance of physical environment of the nursing homes, or performance of administrative tasks. This is clarification that we felt was important to be provided because sometimes when some of these nursing homes are communicating about the direct care, it can be confusing. We wanted to put it into writing that what the direct care is. There's language about the minimum staffing levels as well in this bill to make sure that our residents in nursing care facilities are safe and get the best care. Any questions or comments? Going once. Representative Claritas Teacher.
Thank you, Mr. Chair. Can you just give us some clarification on how they came up in section 3 with the delineation of the 0.55 hours, 0.29 hours, and 2.16 hours?
Sure. The bill actually gives specific numbers, and then that's what we are talking about. And to put them first, let me explain to them the exact numbers. It's asking that the registered nurses would have 55 of 100th of an hour, and we are talking about the direct care be 3 hours per resident per day. And then within those 3 hours, 55th of 100 of an hour is going to be by an RN, and 29th of 100 of an hour be by LPN, and then 2 hours and 16th of 100 of an hour be by a nurse's aide. So that's what the numbers are to complete that 3 hours. And the rationale for that is based on the existing expectations, and the source of that expectations. I'm just going to check just to be sure I'm accurate, if you would allow me. Give me 1 second. This was from a group of advocates who are focused on the safety and well-being of people in nursing care facilities.
Okay, thank you. And Mr. Chair, how will these hours be enforced?
We are defining what is going to be expected. So the nursing homes are responsible to give that information to the Department of Public Health. So DPH will be involved. Thank you. Seeing no other questions, Madam Clerk, Madam Administrator, can we have a roll call, please?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy Vehi,
McCarthy Vehi votes yes.
Senator Kushner,
Senator Kushner votes yes.
Senator Marks,
Senator Marks votes yes.
Representative Parker,
Representative Parker votes yes.
Senator Summers, Representative Claritas Detrier,
Representative Claritas Detrier votes no.
Representative Belton,
Belton votes yes.
Representative Berger Givallo, Senator Cabrera, Representative Carpino, Representative Cook, Representative Dauphiné, Representative DiCaprio, Representative D'Amico,
D'Amico votes yes.
Representative Denning, Representative Elliott, Representative Jengo,
Yes.
Representative Gilchrist,
Yes.
Senator Gordon,
Senator Gordon votes no to flag it.
Representative Cabras DeGraw,
Cabras DeGraw votes yes.
Representative Kitt,
Representative Kitt votes yes.
Representative Kennedy, Representative Lenahan,
Linehan votes yes. Thank you.
Representative Morrow, Representative McCarthy, Representative Palm, votes Representative-
yes.
Thank you. Representative Perello. Representative Raider,
Representative Raider votes yes.
Senator Rahman,
Senator Rahman votes yes.
Representative Reddington Hughes,
Representative Reddington Hughes votes no.
Representative Ryan,
Representative Ryan votes yes.
Senator Slapp, Representative Steinberg,
Representative Steinberg votes yes.
Representative Tersiak, Representative Welander,
Representative Welander votes yes.
Representative Zupkis,
Thank
thank you,
you.
Mr. Chair.
Thank you, Madam Administrator. We will keep the votes open till 4 p.m. So next item on the list is item number 4, Senate Bill 275. Can we entertain a motion to JF to the floor, an act prohibiting nursing homes from rejecting a patient solely on the basis that such patient receive mental health services? Okay.
So moved.
Moved by Representative Kristen McCarthy-Vehy and seconded by Senator Summers. I think this the title itself explains it pretty fairly well. Nobody should be rejected from receiving care in a nursing home based on their mental health services. Representative Clear Teacher.
Thank you, Mr. Chair. I make a motion to start a consent calendar and add this item, please.
Thank you. Seeing no objection to creating of the consent calendar and seeing no objection to including this in a consent calendar, it is on consent calendar. And you've seconded the motion. And good. Perfect. Moving on to the next item on the agenda, which is number 5 on the agenda, Senate Bill 368. We will entertain a motion to JFS, an act concerning Source Plasma Donation Center's proposed action, LCO number 3231. Okay, and has been moved and seconded, moved by Representative Kristen McCarthy-Vehy, and Representative Claire Desditra has seconded this. Let me explain this bill. This is a bill many of us in this committee are aware of. This is something that we have been looking at for the past 3 years. We have passed this almost unanimously every time for the past 3 years. And there were some tweaks that were needed in this bill for the implementation perspective. We wanted to thank all the people who came to speak for the tweak, including American Red Cross and various other organizations that have been part of it. The tweaks are about access for the presence of a nurse at the time of the blood donation. And the other one was the physician who is going to be at that center, their training and experience perspective, and that was limiting their functionality, and that has been changed in this bill. Seeing no questions or, well, so Representative Claire Desditra.
Thank you, Mr. Chair. I'd like to add this item to the consent calendar.
And seeing no objections, this is added to the consent. Thank you. Next item is item number 6, Senate Bill number 370. We are going to entertain a motion to JF to the floor and act concerning peer-run respite centers for persons experiencing a mental health crisis. Do we have a motion? Okay, same pattern of moving and seconding. Representative Kristen McCarthy-Vehy has moved and seconded by Representative Claire Desditra. This is as explained, and we want to thank all the people who came in and speak about this bill, about the peer-run respite centers and how they can be instrumental in mental health crises. Representative Claire Desditra.
Thank you, Mr. Chair. I'd like to add this item to the consent calendar.
Seeing no objections, we will add this to our consent calendar as well. And if I may just jump to item number 8 for a second, and then we will come back to item number 7. Item number 8, we will entertain a motion to JF to the floor, House Bill number 5003, an act concerning child and family nutrition. And moved and seconded, same movers and seconders, movers and shakers. And with that, any discussion? This is a priority bill. But yes, Senator Gordon.
Thank you, Mr. Chairman. I have a question or something I think we should be aware of, that it looks like, if I'm correct, the words within available appropriations was removed once or twice. So I just want to make certain that if this bill moves forward, we just have an understanding that if we're going to remove those words, or if it gets removed, what does that really mean, and what could that potentially tag the state with regards to potential costs? So I just wanted to highlight that so it's on the record. Thank you.
Same, noted. And
Thank you, Mr. Chair. I'd like to add this item to the consent calendar.
seeing no objections, we will add this to the consent calendar as well. Okay. We'll go back now to item number 7, which is Senate Bill number 440, an act concerning certificate of need. Do we have a motion to JF this to the floor? So moved by Representative Kristen McCarthy-Vahey and seconded by Representative Claire DeStetra. I will explain a couple of things about this bill. We have heard about CON. It's a very complex process. Where the certificate of need, we have multiple bills during this session around certificate of need. We have Senate Bill 9 that is going to look at some components of this. There is Senate Bill 440 that is looking at this as well. And you will have House Bill 5316 that you will hear about at this time. Because there are so many stakeholders that are involved in these bills, we do not have the timeline to be able to have all of those conversations right now. So this is clearly a work in progress. Many of these bills may in some respects be in conflict with what they are stating. And that's why they need to require many of the stakeholders to be in the same room at the same time and lock the room till we fix it. But we don't have the time to do this. And so we're going to do this after we JF this. So as I speak, I want people to know that this is truly work in progress, and you will hear the same thing pretty much rewind and play again for 5316. But so I wanted to mention this here, and Representative Kristen McCarthy-Vahey.
Thank you, Senator. I will just take an opportunity to underscore the senator's comments, particularly with such a large issue, which is one that really looks at balancing the needs of how we as government assure the safety, access, transparency, equity for our residents, and also assure that we continue to provide availability in our healthcare marketplace. And we will be continuing these conversations as committee members. We will be spending a lot of time together on this issue, I'm sure. I'm looking at Rep. Claire DeStetra and Senator Summers. But I also would note that we will likely be continuing these conversations in future sessions as well, because as we look at the changing marketplace for healthcare, and Senator Looney spoke to this when he was here at our public hearing with the Attorney General, we know that the issues continue to evolve, and we also, as a body and together with the executive branch, will continue to have to evolve as these different scenarios come up. So I am grateful for the opportunity for us to take steps during this session, but we will be continuing to engage with stakeholders. We've been hearing via email, we've received phone calls, we've talked to folks in the hallways, we're talking with our colleagues. This is very, very much an ongoing conversation. Thank you, Mr. Chair.
Perfect. Seeing no other comments, Madam Administrator, can we have a roll call, please?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy-Vahey,
McCarthy-Vahey votes yes.
Senator Kushner,
Senator Kushner votes yes.
Senator Marks,
Senator Marks votes yes.
Representative Parker,
Representative Parker votes yes.
Senator Summers,
Senator Summers votes yes.
Representative Clarice Detrier,
Representative Clarice Detrier votes yes.
Representative Belton,
Belton votes yes.
Representative Berger Givallo, Senator Cabrera, Representative Carpino, Representative Cook,
Cook votes yes.
Representative Dauphiné, Representative DiCaprio, Representative D'Amico,
D'Amico votes yes.
Representative Denning, Representative Elliott, Representative Django,
Yes.
Representative Gilchrist,
Yes.
Senator Gordon,
Yes.
Representative Cavus DeGraw,
Galvez DeGraw votes yes.
Representative Kitt,
Kit votes yes.
Representative Kennedy, Representative Linehan,
Linehan votes yes.
Representative Morrow, Representative McCarthy, Representative Palm,
Palm votes yes.
Representative Perello, Representative Rader,
Representative Rader votes yes.
Senator Rahman,
Senator Rahman votes yes.
Representative Reddington Hughes,
Reddington Hughes votes yes.
Representative Ryan,
Yes.
Senator Slapp, Representative Steinberg,
Representative Steinberg votes yes.
Representative Tersiak, Representative Welander,
Representative Welander votes yes.
Representative Zopkis. Thank you, Mr. Chair.
Thank you, Madam Administrator. Just a reminder, we will keep the votes open till 4 p.m. If you change your votes, you can do that till 4 p.m. too, just saying. Section, item number 9, House Bill number 5316, we will entertain a JF to the floor and act concerning the Office of Health Strategies recommendations regarding the Certificate of Need program. Do we have a motion? And is there a second? Second, Senator Marks is seconded, and Representative Kristen McCarthy Vahey moved this bill. This is again CON, complex issue, multiple perspectives. Not all perspectives align. We need conversations. We need to pass this out of the committee so we can continue those conversations. Many of us who have already stated they're not happy with all parts of this bill, but we are trying to continue the conversation, and that's the purpose of voting for this. Just because we are voting for this in its current form does not automatically mean that we are going to vote for it in its current form should the form not change during the course of the legislative process. Seeing no other comment, Senator Gordon.
Thank you, Mr. Chairman. I understand the need to have conversations, and I'm going to vote no on this bill because I don't think it's a good bill. And I think we have other vehicles that are better to further the conversation, such as 440. So I'll be a no vote for that reason. Thank you.
Thank you. Any other comments? Seeing none, I was going to say all in favor. Madam Administrator, can we have a roll call vote?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy Vahey,
McCarthy Vahey votes yes.
Senator Kushner,
Senator Kushner votes yes.
Senator Marks,
Senator Marks votes yes.
Representative Parker,
Representative Parker votes yes.
Senator Summers,
Summers votes no.
Representative Clarice Detrier,
Clara DeStitria votes no. Big red flag.
Representative Belton,
Representative Belton votes yes.
Representative Burgess Jibala, Senator Cabrera, Representative Carpino, Representative Cook,
Cook votes yes.
Representative Dauphiné, Representative DiCaprio, Representative D'Amico,
D'Amico votes yes.
Representative Denning, Representative Elliott, Representative Gilchrist,
Yes.
Senator Gordon,
Senator Gordon votes no.
Representative Calvert DeGraw,
Mr. Chairman, point of order.
Yes.
I heard Gilchrist called, but my name comes before hers and I haven't heard it called.
Madam Administrator, can we just make sure Representative Jenga's name is called again?
Representative Calvert DeGraw, Representative Django,
Yes. Thank you.
Representative Kidd,
Representative Kidd votes yes.
Representative Kennedy, Representative Linehan, Representative Morrow, Representative McCarthy, Representative Palm,
Yes.
Representative Perello, Representative Rader,
Rader votes yes.
Senate. Thank you. Senator Rahman,
Oh, yes.
Representative Reddington Hughes,
Reddington Hughes votes no.
Representative Ryan,
Representative Ryan votes.
Senator Slack, Representative Steinberg,
Representative Steinberg votes yes.
Representative Tersiak, Representative Wielander,
Representative Wieelander votes yes.
Representative Zupkis. Thank you, Mr. Chair.
Thank you, Madam Administrator. That brings us to item number 10, House Bill 5424, an act prohibiting adverse actions against healthcare providers for providing certain healthcare services. We will entertain a motion to JF this to the floor and seconded by you. So moved by Representative Gilchrist and seconded by Representative Kristen McCarthy-Vahey. For discussion, this is an important bill. We've heard about this bill. This is making sure that providers' provision of comprehensive medically accurate information and counseling to patients on their health status regarding reproductive or gender-affirming healthcare services or information be available and would be provided to those individuals. If in emergent situations, they need to be provided that information, they can inform the individuals, including complications of pregnancy, including miscarriage, management and treatment for ectopic pregnancies, and if failing to provide the services would violate the standard of care or present a serious risk to the patient. And this is where the providers will be protected if they direct the care and for the best place, for the best option for treatment for individuals. So that's the purpose of the bill, for that protection of providers. It is not changing any scope. It's just informing and protecting the providers. Seeing, yeah, Representative Kristen McCarthy-Vahey.
Thank you. And I did just want to let folks know that our Hospital Association and the Attorney General's Office, as well as Planned Parenthood, are working on some slight changes to the language. So while we do have JF language here, we can expect to see some changes to hopefully help tighten that up as well. Thank you.
Senator Gordon.
Thank you, Mr. Chairman, and I look forward to seeing what wording may come out. But I just want to quickly preface my remarks that I always look to support all of our individual rights and also all of our medical freedoms. And I've done that even before I was a senator, and I continue to do that as a doctor. I have some concerns about this bill, and I look forward to seeing if things get addressed in further wording. I don't have concerns about providing care per se, but this also gets into some private contracts that people knowingly sign. I'm not talking about public hospitals, but private hospitals. And we've heard from some hospitals about that in their testimony. And there's a difference between what this bill is doing with regards to gender affirming healthcare, which I don't necessarily, I'm looking at the merits on that, and also what we do with reproductive healthcare. And I think we need to look at both in separately as far as how those cares are provided. But there's also two different tracks in this bill, which I think should be looked at separately. One is the care that's provided in a non-emergency setting. And again, we have to look at that, what's happening in some of the private hospitals, but also what the care is being provided in an emergency setting. And quite frankly, in an emergency setting, it may not even matter what a hospital may have in its provisions. There's the federal EMTALA law. That supersedes basically everything. And that dictates, quite frankly, in very lengthy regulations, and for years, how care is provided in emergency situation. And this bill is talking about emergency care, but quite frankly, any concern about that, that care is having to be provided anyway. And so I have a concern about the wording. And so I am going to have to vote no on this bill to flag it. But not necessarily because I want to prevent care to anyone. I just have concerns about some of the logistics, getting into private contracts and the difference between the different types of care and the different settings of care. Again, very different between emergency care, which already is heavily regulated, and non-emergency care. And I do very much look forward to what may come out with further wording to address various concerns and see what we might be able to do to further help patient care, but also the hospitals and settings that provide that care, and not get into unnecessarily things that are already dictated and controlled by federal law. Thank you.
Thank you. Representative Gilchrist, followed by Representative Clear Teacher.
Thank you, Mr. Chair. And thank you to the committee for raising this important bill. Just want to speak in support that we really just want to ensure that patients have access to medically accurate information. And we heard from providers at the public hearing that there is confusion over what they are allowed or not allowed to say in Catholic affiliated hospitals. And so this bill is really just seeking to ensure that a medically trained provider can speak with a patient about their options. And as we are seeing across this country, unfortunately, women are dying as a result of bans that have been put in place. And so we want to ensure that in the state of Connecticut, if a woman presents at a hospital and is having medical complications connected to pregnancy, that she is treated or directed to care where she can be treated. And so I appreciate this committee raising this important bill. Thank you.
Thank you. Representative Clear Teacher.
Thank you, Mr. Chair. To reiterate what Senator Gordon said, we know that Catholic hospitals do provide care, excuse me, in emergency situations. This bill clarifies what we want done all the time, that people get the right information, that you're just guided to know your options. And we know that amazing ancient Greek physician Hippocrates said, first do no harm. And that's what our healthcare providers are there for. Giving information is first do no harm. And that's what this bill does. So I hope we can tighten up some of the language and be able to move this bill forward together. Thank you, Mr. Chair.
Thank you. So seeing no more comments, Madam Administrator, can we have a roll call, please?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy-Vahey,
McCarthy Vahey votes yes.
Senator Kushner,
Senator Kushner votes yes.
Senator Marks,
Senator Marks votes yes.
Representative Parker,
Representative Parker votes yes.
Senator Summers,
Senator Summers votes yes.
Representative Clarice Detrier,
Clarice Detrier votes yes.
Representative Belton, Representative Burger Givallo, Senator Cabrera, Representative Carpino,
Carpino votes yes.
Representative Cook,
Cook votes yes.
Representative Dauphiné, Representative DiCaprio, Representative D'Amico,
D'Amico votes yes.
Representative Denning, Representative Elliott, Representative Jengo,
Yes.
Representative Jengo.
Yes.
Thank you.
Thank you.
Representative Gilchrist,
Yes.
Senator Gordon,
Senator Gordon votes no to flag it.
Representative Cavers DeGraw, Representative Kidd,
Kidd votes yes.
Representative Kidd. I did not see you on screen, please.
Representative Kidd votes yes.
Thank you. Representative Kennedy, Representative Linehan, Representative Morrow, Representative McCarthy, Representative Palm,
Yes.
Representative Perrello, Representative Rader,
Representative Rader votes yes.
Senator Rahman,
Senator Rahman votes yes.
Representative Reddington Hughes,
Reddington Hughes votes no.
Representative Ryan,
Representative Ryan votes yes.
Senator Slapp, Representative Steinberg,
Representative Steinberg votes yes.
Representative Tersiak, Representative Wielander,
Representative Welander votes yes.
Representative Zupkis. Thank you, Mr. Chair.
Thank you, and we'll keep the votes open till 4 p.m. today, and you can vote through Zoom or in room 3000. So don't go yet. We are going to have the consent calendar vote. And with that, we will take the vote on the consent calendar, which includes item number 4, Senate Bill 275, an act prohibiting nursing homes from rejecting a patient solely on the basis of for such patients receiving mental health services. Item number 5, Senate Bill 368, an act concerning source plasma donation centers. Item number 6, Senate Bill number 370, an act concerning peer-run respite centers for persons experiencing a mental health crisis. And item number 8, House Bill 5003, an act concerning child and family nutrition services. Madam Administrator, can we have the roll call, please?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy Vehi,
McCarthy Vehi votes yes.
Senator Kushner,
Senator Kushner votes yes.
Senator Marks,
Senator Marks votes yes.
Representative Parker,
Representative Parker votes yes.
Representative Parker, I did not see you on screen, please.
Hello, Bev. Can you see me now?
Thank you.
Representative Parker votes yes. Thanks.
Senator Summers, Representative Clarice Detrier,
Clarice Detrier votes yes.
Representative Belton, Representative Burger Givallo, Senator Cabrera, Representative Carpino.
Yes.
Thank you. Representative Cook,
Cook votes yes.
Representative Dauphiné, Representative DiCaprio, Representative D'Amico,
D'Amico votes yes.
Representative Denning, Representative Elliott, Representative Django,
Yes.
Representative Gilchrist,
Yes.
Senator Gordon,
Yes.
Representative Cavers DeGraw,
Yes.
Representative Kennedy, Representative Linehan,
Bev, I think you skipped Representative Kit.
Representative Kidd,
Kit votes yes. Thank you.
thank you. Representative Linehan, Representative Morrow, Representative McCarthy, Representative Palm,
Palm votes yes.
Representative Perello, Representative Rader,
Representative Rader votes yes.
Senator Rahman,
Senator Rahman votes yes.
Representative Reddington Hughes,
Reddington Hughes votes yes.
Representative Ryan,
Representative Ryan votes yes.
Senator Slack, Representative Steinberg,
Representative Steinberg votes yes.
Representative Tersiak, Representative Wielander,
Representative Welander votes yes.
Representative Zopkis. Thank you, Mr. Chair.
Thank you. We'll move to item number Roman numeral 4, which is announcement of time and date of next meeting. And there will be a committee meeting which will be held on Friday, March 22nd at 1 p.m. Looking forward to seeing everybody here. And after that, we are going to be in recess till 4 p.m. Please vote in room 3000 or via Zoom. Thank you, everyone.
Representative Steinberg,
Madam Clerk,
Yes.
I wish to change my vote on item Senate Bill 273 to the negative, please.
thank you, sir.
Thank you.
You're welcome. Representative Carpino,
I've missed a few votes, ma'am. I'd like to make them now.
how would you like to vote on Senate Bill number 1, item 1
No.
on the agenda?
No, please.
Item 3 on the agenda?
No.
Item 7, Senate Bill 440?
Yes.
Item 9, House Bill 5316?
No.
And you voted on the last bill and you voted on consent, so you're all set.
Thank you.
You're welcome. Rep. Linehan,
Hi, Bev. Thank you.
how would you like to vote on the consent calendar?
Yes, please.
Item number 9 on the agenda, House Bill 5316.
Yes.
And item number 10, House Bill 5424.
Yes.
Thank you.
Thank you. Have a great day.
Same to you. Representative Cavus DeGraw. Senate Bill number 1, item 1 on the agenda. How would you like to vote? Representative Cavus DeGraw.
Test, I think, let me. Beth, can you hear me? Hear it through there? Want to make sure. Okay. All right. Item. Number 2 was a hold, SB 9. So item number 3, SB number 273, how do you like to vote? Yeah. SB number 275, consent. Yeah. So next is SB number 440. How do you vote? That's right now. No? 503 was on the consent. Next is item number 9, HB number 5316. How do you like to vote? Yeah. And then item number 10, HB number 5424. How do you like to vote? That is a yes. And the restaurant consent. Yes. Okay. You're all set. Thank you, Peter. No problem. All right, back down to the fence.
Briefly on this underlying bill, right?
Yeah,
Okay.
I'll let you know.
Yep.
So we had a roll call on SB number one.
Yes, yes.
We held item number two,
Okay,
and number three, we had a roll call.
yes,
And then we had 4, 5, and 6 on the consent. And next we had 7 as a roll call. Are you guys- Yes. For number 8 was consent. Number 9, we had roll call. Would you like to vote?
yes,
And then the last one, number 10, how would you like to vote? That's roll call.
yes.
Okay, I got that.
Okay. Beautiful, thank you.
No problem. Hi, can you hear me?
I can hear you. Can you hear me?
Yeah, okay, that's good. I just need to turn up my. Okay. Are you ready?
I'm as ready as I'll ever be.
Okay. Item number 1 on the agenda, SB1, that was a roll call vote. How do you like to vote?
Okay, that's gonna be a no.
Okay. Item number 2, SB9 was put up, we held that for the next meeting. So next, we voted on item number 3, SB number 273, that was a roll call. How do you like to vote?
Okay, so that's SB 273.
Yeah, item number 3, yes, correct.
Okay, that's gonna be a no.
Items number 4, 5, and 6 were on the consent calendar. So the next one to be on roll call was item number 7, SB number 440.
Okay. Yes. Yes, on number 7.
Yeah, that was item number 7. Yeah. Item number 8 was put on the consent calendar, HB number 5003. So the next one on the roll was item number 9, HB number 5316.
That's gonna be a no.
Item number 10, HB number 5424. That was the roll. How do you like to vote?
That's a no on that. No on number 10.
Okay. And the last is consent. How do you like to vote?
And the consent, I'll vote yay on those. And that's just go back. That's number 4,
Yeah, correct.
5, 6. And there was one more you said, right?
8. Yeah, 8.
8. Okay, yeah, that's good.
Okay. All right. I got you. You're all good.
All right. Thank you very much.
Good day.
You too.
Thank you. Hi.
Hey, how are you?
I'm good. How are you? Okay.
Good. Good, thanks.
Great. So, are you ready?
Yes.
Okay. So item number 1 on the agenda, SB number 1, that was a roll. How would you like to vote?
Yes.
Item number 2, SB 9 was held for Friday's committee meeting. So next is item number 3, SB number 273, that was a roll. How would you like to vote?
Yes, please.
Item number 4, SB number 275 was put on the consent calendar. Item number 5, SB number 368 was put on the consent calendar. Item number 6, SB number 370 was put on the consent calendar. Item number 7, SB number 440 was a roll. How do you like to vote?
Yes.
Item number 8, HB number 5003 was put on the consent calendar. Item number 9, HB number 5316 was a roll. How do you like to vote?
Yes.
And item number 10, HB number 5424 was a roll. How do you like to vote?
Yes.
And how do you like to vote on the consent calendar?
Yes.
Okay, you're all set.
Thanks so much. Have a good day.
You too. Bye.
Thanks.
I do. Yeah, okay. Okay. Just tell me when you guys are ready.
Ready?
Okay. So item number 1, SB number 1 was a roll call. How do you like to vote? Representative Mara?
No.
No? And Representative Zupke? No? Okay. Next on the agenda was SB number 9. That was held for the next committee meeting. Item number 3, SB number 273. That was a roll. How would you like to vote? Representative Mara? No? And Representative Zupke?
No.
Item number 4, 5, 6 was put on the consent calendar.
Okay.
So next is SB number, or is item number 7, SB number 440. How do you like to vote?
Yes.
Yes.
Oh, it's 440, right?
440, yes, item number 7.
Yes.
Item number 8 was put on the consent calendar. And then next is HB, or item number 9, HB number 5316. How do you like to vote?
No.
No. And then last, item number 10, HB number 542. How do you like to vote? No.
No.
And then last is the consent calendar.
Yes.
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 Okay, you two are all set.
Oh my God. Makes it harder.
Hear you, see you now.
How are you?
Good, how are you?
Good.
Are you ready?
I am.
I'm back and forth down there and I'm thinking.
Item number one, SB number one, how would you like to vote?
SB number one? Oh, wait a
Yeah.
minute, I'm looking at the wrong paper. Hold on. I'm on the, no.
Oh, okay. So here on SB number one, you'd like to vote no?
And I do.
SB one, I'm a no. Daphne's a no.
Staying with it, and then I feel like I'm hurting
Item
my group.
on the agenda was health.
But I'm
committee
trying,
meeting.
but
So,
it'll get better if
item
I
number-
stay.
SB
If
number
I stay there,
3.
it'll get better if it. If it's
That was
gonna
Oh,
be-
not, oh, that's right. We skipped over 9. Okay, yes, no. I'm a no on 273.
You get it, thank you.
Item number 4, 5, and 6 were put on the consent calendar.
Okay, not 7.
So, no, that was a roll. How would you like to vote?
On number 7, a yes.
I don't have my bills in
Then
order.
item number 8,
I need to know.
that was on consent number 5003.
Okay.
And-
Yes, yep.
And then number 9, HB number 5316, that was a roll. How would you like to vote?
I would be a no.
And then item number 10, HB number 5424, that was a roll. How would you like to vote?
I would be a no.
And then how do you like to vote on the consent calendar?
Yes.
Okay, you're all set.
Thank you so much. Have a great day and great weekend. No, we're only on Wednesday, darn. Okay,
know.
thanks. Bye. How can we only be on Wednesday? Seems
I
like
know.
Friday.
Representative Pearl, I'm ready for you. Ready?
Okay.
Hmm?
So, item 1,
SB number 1, how would you like to
do you have to call them out or you want me just to run through?
You
I've got
can-
my list here.
You can run through if you want.
Yeah,
But,
I'm a no on item 1.
number 1. Okay, and then
I'm a
item
yes
number-
on item 2.
Item 2, we held that, so we didn't vote on that.
Oh, okay. Maybe you should run through it.
Yeah, okay, okay. And then item number 3, that was a roll, SB number 273, how do you like to vote?
I'm a no vote on 3.
Items number 4, 5, and 6 were put on the consent calendar. So item number 7, that was a roll, how do you like to vote?
Yes.
Item number 8, that was put on the consent calendar. So item number 9, HB number 5316, that was a roll, how do you like to vote?
I am a no.
And then item number 10, HB number 5424, that was a roll, how do you like to vote?
Give me just 1 second.
Yeah, no,
I'm sorry about that.
it's okay.
I promise to be quick. No,
So for item number 10, you'll be voting no?
that's 10. Yes, correct.
Mhm.
Correct. I am a no on 10.
I got it. And then for the consent calendar, how you like to vote?
I'm a yes on consent, of course.
You're all set.
Thanks so much.
Yeah, no problem. Have a good day. Okey dokey. Okay, so item number one, FP number one, the roll call, how would you like to vote? Oh, I'm yes on that. Item number two was held for, Friday committee meeting. So next is FP number 273. Yeah, right for that. And I put the 370 October, also. Consent, yeah, there we, yeah. Or 40, that's our next roll call, how would you like to vote? I know yes on that. Number 8. move on to consent. So next is HB number 5316, how do you like to vote? Yeah. Last is item number 10, HB number 5424, how do you like to vote? Love that bill, yes. And how do you like to vote on the consent calendar? I vote yes on. Thank you very much. You're all set. Right, you're unmuted. All right. So first on the agenda, for first is item one, asking a moment, I'd like to vote.
No.
Next, item number two was held for the next committee meeting.
Oh, okay. I didn't hear all that. Okay. Number three, SB 273.
How do you like it? And item number 4, 5, and 6 were on the consent calendar.
Okay, yeah,
And then item number 7, SB number 440, how do you like to vote?
yes.
And then item number 8 was put on the consent calendar. Item, and then item number 9, HB number 5316, how do you like to vote?
No,
And last, HB, or item number 10, HB number 5424, how do you like to vote?
no.
And then on the consent calendar, how do you like to vote?
Yeah.
We're all set.
Okay, thank
Okay,
you so much. How's it going? Aye. Hello?
All right, I'm just gonna check which votes you did vote and which ones you're missing, okay? So I
Okay.
have you for SB 1, SB 273, SB 440, 5316, 5424. That's item number 10 on the agenda. I'm missing on that one. How would you like to vote?
Yes.
Yes. And then how do you like to vote on the consent calendar?
Yes.
Okay. And
Oh, I only did two. Good. Okay.
okay, yeah, you only missed it. Yeah, you're all good.
All right. Thank you.
Bye.
Bye.
Okay. Item number one, SB one, yes, as a roll call, yes. Item number two, held to the next committee meeting. Item number three, SB number 273, how do you like to vote? Yes. 4, 5, 6, flip on the consent. The next item, that was the roll, is item number 7, SB number 440, how do you like to vote? Yes. Item number 8, on consent calendar. Item number 9, HB number 5316, how do you like to vote? Yes. Item number 10, HB number 5424, how would you like to vote? Yes. And how do you like to vote on the consent calendar? Yes. Yep. Thank you. Yeah, have a good day. Hi. Oh.
How are you?
Good, how are you?
I'm well. Sorry, I missed some votes.
Okay, are you ready?
Yep, I'm ready.
Item number one, SB number one, that was roll call. How do you like to vote?
Senator Cabrera votes yes.
On item number two was held for the next committee meeting. Item number three, SB number 273, that was a roll call. How do you like to vote?
Senator Cabrera votes yes.
Items 4, 5, and 6 were put on the consent calendar. Item number 7, SB number 440 was a roll call. How do you like to vote?
Senator Cabrera votes yes.
Item number 8 is put on the consent calendar. Item number 9, HB number 5316, that was a roll. How do you like to vote?
Senator Cabrera votes yes.
And then item number 10, HB number 5424, that was a roll call. How do you like to vote?
Senator Cabrera votes yes.
And how do you like to vote on the consent calendar?
Senator Cabrera votes yes.
Okay, you're all set. All right.
Thank you.
Yeah, no problem. Have a good day. Hi. Hello. No. Okay. We only have you missing for. Can you hear me? All well? Oh, I can't hear you. No, I can't hear you. Okay.
Okay, can you hear me now?
I can hear you now. Okay. All right.
Okay. All right,
Oh.
sorry about that. All right,
So we're only missing.
go ahead.
Yeah. All we're missing is number 3, SB number 273. Would you like to vote?
Okay, that one I'm gonna vote no.
Okay.
I think I missed the consent calendar too, didn't I?
Yeah. So how would you like on the consent calendar?
Vote yes.
Okay. And let me just
And
make
was there
sure.
any others that I missed?
I'll just make sure right now.
Okay, I thought I missed like a couple towards the end. Maybe not.
Yeah, no, you're all set. You can still do.
Okay,
Have a
thank
good day.
you.
No problem.
Bye.
SB number 1, I'll be up for vote.
I think that's a no vote.
Item number 2 is held.
Yeah.
Okay. Item number 3, that was a roll call. How do you like to vote?
Yeah, I'm gonna vote yes.
4, 5, 6 items are on consent. So item number 7, 440, how do you like to vote? Just roll.
I will vote yes.
Okay. Item number 8 was on the consent calendar. So item number 9, how do you like to vote? And then the last one, item number 10, HB number 5424.
That's also a no vote.
Okay, and then on the consent calendar.
I believe that is a yes.
Yeah, you're all set. All good.